Hi guys, good morning, good afternoon, good evening, wherever you are in the world. Thank you for watching this video. Today's topic, really important, and important because it is something that I use extensively in my clinical practice. It is the positive impact of hypnotherapy when I'm supporting people who are living with dementia and their families too. So let me give you a little bit of background about this. Back in 2004, my colleague, Dr. Simon Duff, and we decided to embark on a piece of research that would look at the possible impact of hypnosis for people who are living with various kinds of dementia. This we did in Liverpool. And so we kind of embarked on this little research project where we had a number of people who received hypnotherapy, a number of people who received treatment as usual, so nothing different in their lives, and then another group of people who had they were a control group and they attended a weekly discussion group. And we ran this project for 9 months. So what happened? Every week I would use hypnotherapy with the participants for 9 months. And my colleague, Dr. Duff, would review the scientific data, and together we would put it together and we would look at the results, the outcomes. It was a double-blind study. And hey, we found some really interesting stuff. So we decided to send it for publication. And in 2005, it was published in the European Journal of Clinical Hypnosis. And what we were able to demonstrate is that hypnosis appeared to improve people's quality of life over 7 key areas. And those areas included memory for significant life events, immediate memory or short-term memory, as it is often referred to, relaxation, concentration, we saw people's concentration levels improve, motivation, activities of daily living, we saw an improvement in people's activities of daily living. And these people that were involved in this study lived in, there was two lots of people. Some lived in a nursing home for people who have dementia, and some people lived in a residential home for people who were living with dementia. And socialization also improved. So that was very interesting. We found that to be really interesting. And so 12 months post-hypnosis, 12 months post-treatment, we decided to go back and do a longitudinal study. And we were amazed at what we found. We saw continued improvement over those 7 key areas. So in 2006, that article was published, or that paper was published in the European Journal of Clinical Hypnosis. And then in 2007, we had our work published in the US. And that is how I ended up working in the US. It was the main reason why I came here. So the use of hypnosis is so important when we're supporting people who are living with dementia. It helps them live better. It helps improve quality of life. So how does hypnosis work? And why is it so powerful for people who are experiencing the symptoms of a dementia type illness? And also, how does it benefit relatives and people who support that person on their journey? So if you think about the brain, let's think about the brain. The brain is one of the most important organs in our body, of course. It's considered to be like the engine room of the body. When we're using hypnosis, we actually bypass the brain. We're not working with the brain, we're actually working with the subconscious mind. So our mind has 2 levels. Some people might say 3, but for the case of this work and the work that I do, I consider it to be 2 levels. We have consciousness, and our consciousness is what we're actually using now. But it only accounts for between 5 and 10% of all our thoughts, all our ideas, experiences, principles, morals, ethics. That is about between 5 and 10%. And that's what we're using right now to listen to this video. Behind that, if we are able to open a sliding door, we can access the subconscious mind. Again, we're bypassing the mechanics of the brain, and we're talking to the mind, and we're talking to the subconscious mind, where approximately 90 to 95% of all our experiences, our thoughts, our beliefs, our ethics, our morals, our principles, that's where they live. So when people who are living with dementia get to a certain stage on their journey, they may start experiencing some negative symptoms of past traumatic experiences. And they may present in ways that appear to be negative in behaviour. And they may not always be able to understand where it's coming from, why it's happening. So the power of hypnosis is to get into there, bypass the brain, talk to the subconscious mind, make some suggestions, some post-hypnotic suggestions about releasing that negative energy, releasing that trauma. And we don't have to spend weeks and months and years in trauma work, in psychoanalysis or psychotherapy, because hypnotherapy can work in a very short space of time. Sometimes only one session is necessary. I always recommend that we do 6 sessions once a week for the first 6 weeks. And then at week 4, we evaluate it and we see where we are and how the behaviour's changed and how that has impacted on the family and the wider network. So the use of hypnosis is so important when we are working with people who are living with a dementia type illness. So any of my patients who are watching this video who have actually experienced hypnosis with myself, please feel free to share your experiences on this YouTube channel so that other people can see the benefits of it and the power of it too. Over the years, myself and Dr. Duff have trained many people around the world to use hypnosis with people who are living and experiencing the symptoms of a neurocognitive or a neurological disorder. So it is important that you get any kind of support from those people. It takes a specific type of training. Not your run-of-the-mill mainstream hypnotherapist can use this technique and this process and this approach. It needs to be somebody who's specifically trained. And we do have people around the globe. So please, if you're thinking about it, contact us and we will give you the contact details of the nearest Nightingale dementia specialist, the dementia consultant that can use this technique, because they are trained by myself and Dr. Simon Duff to use it.
And can you do it through telemed, or does it have to be in person?
Thank you, Lynn. Good morning, Lynn. Lynn's joining us again today. Fantastic support. I really appreciate you being here and asking these really important questions. Hypnosis can be done via telemedicine, via Skype, via Zoom, via any other platform. That's the word I'm trying to think of. The platform that we use. I use Psychology Today platform, and I always recommend that if possible, you see that person face to face at least 1 or 2 times before you start to work over telemedicine or over Skype, Zoom with hypnosis. Because number one, you need to get to know that person. You need to develop a therapeutic alliance, a therapeutic relationship, a trusting relationship. And then you can start to use hypnosis over telemedicine. So always, if possible, see the person first, or at least get to know them. Good question, Madeline. Got any more?
Yeah, what about, this has come up recently, if someone has a past trauma that hasn't been addressed and they're afraid of using hypnotherapy to help them through this. What's that about? And is it scary? Because I can imagine that the person that's had the trauma probably doesn't want to relive it and doesn't want to bring it back into their forefront.
Yeah, great question. I think there's a huge misunderstanding of how hypnosis works. There's a huge misunderstanding of the therapeutic, the clinical, and the medical benefits of hypnosis. This is because a lot of people just see TV hypnotherapists or hypnosis going on at stage shows and things like that. The use of hypnosis in practice is completely different. You as the client, as the patient, as the individual receiving hypnosis, you are always in control. No way can your therapist or hypnotherapist or clinician, they cannot take that away from you. Because when we open that door to access your subconscious mind, sitting on top here is something called a critical factor, a hidden observer. It's like a little man just sat there watching for anything that makes you feel uncomfortable. And if anything happens during that session where the person feels uncomfortable, then the door will close and you will come out of that hypnotic state. So it's not something that we can control. It's something that you control. You are always in control of. Secondly to that is if people are afraid of what they might say, what they might experience, what they might feel, there is a technique that we use where we don't communicate verbally. It's a matter of following an instruction whilst in hypnosis. So you don't have to talk about it. You don't have to relive it. If and when your subconscious mind is ready to release that trauma, it will do so.
So the person doesn't have to tell you that they had a trauma or what the trauma was.
That's right. That's right. Very often the person does know at a particular level, maybe not consciously, but at the subconscious level, they will be aware that there has been a trauma. So using the technique that we use, we can help that person release that trauma without them having to relive it, experience it, just by release from their whole mind, body and soul. So if you imagine this knot of negative energy sitting deep in the pit of your stomach, that's where that experience lives. And so through working with the subconscious mind, we can release that, and we can release it and get rid of it. And there's very little traumatic experience going on at that time. The individual might cry, they might scream out, they might sob, but that's what is happening when they do that. They are releasing that negative energy, that trauma that hasn't been addressed.
So does that matter whether they have a form of dementia or no form of dementia? Does that apply to everyone, anyone?
Pretty much, yeah.
But why?
Well, because you're working with the subconscious mind, and this is where we bury very uncomfortable stuff. Things that we've experienced in childhood, for example. Things that we don't recall at our conscious level is still living in the subconscious mind. So anything can trigger that. And so when we're working with people who have post-traumatic stress disorder, for example, who don't have a neurological or neurocognitive disorder, they're experiencing similar kind of stuff. So you can help release that trauma without having to spend weeks, months, years using psychoanalysis or cognitive behavior therapy or any other EMDR or things like that. Though EMDR, CBT, they have their place because I use them in practice as well. But the most powerful way of releasing that trauma is through hypnosis. And what will happen, as we've talked about in the research and in my book, A Clinician's Guide to Non-Pharmacological Dementia Therapies, There is a chapter dedicated to hypnosis. It is chapter 3, and it explains a lot more than what I can go into today about the research, and point you in the direction of where you can find those research published papers and things. So it's extremely, extremely important that we think about this modality when we're supporting people.
Okay, so let's say you're working with someone that has a neurocognitive disorder and you're using hypnotherapy and they're starting to improve in some of these 7 areas, which is great. But we know that dementia is a neurodegenerative disease. Does it eventually start to decline the strides they make? Do some things always improve and stay improved, or does eventually the areas that improve tend to go back down again?
So there's a question that talks about individuality. Every person is individual. So it may come to a plateau and it may decline, or it may continue to improve. During the research, it continued to improve. During my clinical practice, it continues to improve. I haven't as yet worked with a patient who's declined because of that. That's a very difficult question to answer, because there's so many other things, there's so many variables going on in that individual's life. It's not just about the neurodegenerative disease, it's about all the external things that are happening too, and all the other physiological things that person might be experiencing and living with, and the medication, the impact that the medication has on people. So you have to look at that individual as each case to answer that question. But hypnotherapy, what we saw during our research was that people who were at a certain stage in their journey, so we used a global deterioration scale and the mini-mental assessment tool as well, the MMSE. We used those 2 tools to measure where the person was in their journey and where the improvements were or not. And we found that people who were at the global deterioration scale, around about 4 and 5, 3, 4 and 5 were the best respondents to hypnosis. However, post-research and years on in practice and years of experience and developing my own skills more and more over the years, then I'm able to see differences with people who are further along that journey than the 3, 4, 5 on the GDS. So that's been an interesting lesson for me to see how that works. And that just reinforces the individuality of each case. But great question, Lynn. Thank you.
Okay. And then can you just speak medically about what you're doing in hypnosis? Is it a deep state of relaxation? Can everyone be hypnotized? Does it matter if you have dementia? You talk about the subconscious mind. So how does that all work? Explain it to us.
Okay, so not many, but some people will say to me, I can't be hypnotized. I've never been able to be hypnotized. People can't hypnotize me. And I can. And we can. And this is because hypnosis is nothing that you don't do to yourself throughout the course of a day. So I'll talk about the stages in a minute, but if you think about the occasions when you've driven from A to C and forgot that you've gone past B, it's a kind of highway hypnosis is what we call that. That's highway hypnosis. And that's typical. Every driver on the planet experiences that at some time. And that's a form of hypnosis. It's a natural form of hypnosis. We might be having a conversation and we might start daydreaming and we might just go off on a tangent and then come back again. Form of hypnosis. When we're listening to a sermon, think about being in church and listening to a sermon. You go into a form of hypnotic state when you're listening to that sermon. So it's a natural state of being. What we do in hypnosis is take you from being conscious into a deep state of relaxation. So we go through what's called an hypnagogic stage, and that's taking you from being alert and awake into the relaxed state, the hypnagogic state. And then you're in hypnosis, and all it is a deep-seated state of relaxation. I teach all my patients how to self-hypnotize, and it's a form of deep relaxation. So when I work with patients, we record the session, and then they will listen to it a couple of times a week, or every single day, as many times as they can, or as many times as they choose to listen to that recording. So they are doing their own self-hypnosis. So anybody who goes to sleep can be hypnotized. And one of the interesting things about hypnosis is, if we think about stages of sleep and we go into REM sleep, where, rapid eye movements, which is, I would very often dream sleep. There are other things that go on in REM sleep, but that's where the dream sleep is, in REM. If you measure those beta waves, the brain waves at a beta level, when you're going into the stage of hypnosis, when you're going through that process, you also hit that same hypnotic state. That the beta waves are the same, the brain waves are the same. So if you go to sleep, which everybody does, then you can experience hypnosis, and you do experience hypnosis every single day.
Everyone, even if you have dementia.
Everybody, yeah. It's just part and parcel of what we do as a human being. And just, I think one of the things I haven't addressed is, how does it work? How does it work for people living with dementia? Because people have this belief, well, the brain is damaged. Depending on the type of dementia and where you are in that stage of dementia determines where the damage is and what's happening. Excuse me, what's happening in the brain. So we are not 100% certain how or why it works. There's a couple of theories. One of the theories, which is postulated by Dr. Dove, is that when we're living with a neurocognitive disorder, we're very often struggling to remember things, and we're getting very stressed, and we get very worried, and we get very concerned that we can't remember somebody's name, and we're really struggling to remember that that's a cup, or that's a chair, or that's my mum, or that's my dad, or that's my sister, brother, son, daughter. We're always having this negative stuff going on inside our mind, inside our thoughts. So it's possible that enhances the impact, the negative impact of a neurocognitive disorder. So when somebody's in this state of relaxation, that all goes away. They're not ruminating on those things because they're in this state of calm. They're in this state of inner peace and tranquility. And this could be one of the reasons why post-hypnosis, people feel much better. Their memory improves, and all those 7 areas that we discussed, they all improve because we're not worried too much. We're not concerned. We're not afraid. Our anxiety, our fear is eased a lot, and you are being empowered and given the opportunity to be in control of things. So that's one possibility, that's one hypothesis. And the second one is, with people who have Alzheimer's disease, acetylcholine is one of the neurochemicals that is deficient. When you hit REM sleep, the brain gets a big shot of acetylcholine. Many people at a certain stage of their journey have real difficulty with their sleep. It's intermittent. it's confusing. They might be awake at night. They might never hit REM sleep. They might not get there. And if they do, they might not get there for very long. So when we go down into hypnosis and we're going into that hypnagogic state and we hit that same level of REM sleep, does the brain release that acetylcholine so that the brain is getting a big hit of that chemical whilst they're in hypnosis? If so, that may be one of the contributing factors to why people improve. So there's a few theories, a few suggestions that we consider, and I certainly consider those to be very important when I'm working with people in practice. So I always think about what are the sleep. We always discuss sleep. We always talk about your sleep pattern, your sleep hygiene, and also how we can improve that. Because if we can improve the sleep state, and research is constantly being published about the importance of sleep where dementia is concerned. Yesterday, I read another piece of research that talked about the importance of deep sleep and the impact that a lack of deep sleep has as being a contributing factor to a neurocognitive disorder. So sleep is really, really important. So if we're helping that person get a big chunk of sleep during hypnosis, they're getting the benefits that a 7.5 hour sleep session would give. That's a great thing too.
Because you also mentioned before that when your body is asleep, that's your brain's chance to clean up and
That's right.
do housekeeping.
That's right, absolutely. That's what sleep does. When we get into that deep state of sleep, that's where all those toxins and all that stuff gets cleaned up. Yeah, so it's really important. Just to add to this, sleep is really important. If we are trying to reduce our risks of developing a neurocognitive disorder in the future, sleep. Focus on sleep. Focus on diet and nutrition and lifestyle.
Can you just go back to my question? I want you to expand more though. If somebody has a form of dementia and you're doing hypnotherapy, how are you able to talk to their subconscious mind if consciously they have difficulty talking with you and following a conversation and remembering things? How is that possible?
Because consciously, if I'm having a conversation with you, I'm relying on your speech and language centers of your brain to work with me. If the speech and language centers of your brain, which are referred to as the Broca's and the Wernicke's area of your brain, if they are damaged and it's very difficult to verbally communicate, then going into the hypnosis and talking to your subconscious mind bypasses all that mechanical stuff. You're not working with the mechanics of your brain, you're working with the thoughts of your mind. So that's why I can have a conversation with you in hypnosis. And that's why you can understand, and that's why there's no dysphasia in hypnosis.
What's the difference then to a regular person who doesn't understand the difference between the mind and the brain?
What is the difference?
Yeah, what is the difference if you keep saying you're talking to the subconscious mind, but the brain might have physical damage to it?
Yeah. So the mind is separate to the brain. There's many theories about this and many schools of thought about this, but basically your mind and your thoughts are and your subconscious mind and your conscious mind are separate than your brain. Your brain is responsible for the mechanics. The brain is responsible for making you work. The brain is responsible for making you live, for making you breathe, for making you walk, for making you talk, and all those other things that we do on a day-to-day basis. Your mind is all about your thoughts and all about how you present your principles and your ethics and your morals and your belief system. All those things are at your subconscious mind. So anybody who does meditation or yoga will be able to tell you that they are able to reach their inner self, their higher self. So hypnosis is a similar kind of thing, because during hypnosis you can reach your higher self. And your higher self is not part of your brain, it's not part of the mechanics. Your higher self is part of your spirit, your soul. So, we've learned over the years, and science has proven over the years, that once somebody is physically dead, their subconscious or their consciousness survives post-death. What isn't known is how long that survives. How long does it survive? That hasn't yet been proven. But what has been proven is that it does. There is that level of conscious awareness, and it survives post-physical death. So this to me demonstrates that we are more than just this body. This is just a body. Our brain, our heart, our lungs, our kidneys, all our organs, all our bones, tissues, it's just a body. What's inside that, what goes beyond that, is our soul, our spirit. That's what makes this. That's what makes Lynn, and that's what makes Daniel. Our soul, our spirit. That's what builds our personality. So the difference is that the brain is the mechanical aspect, and the mind is beyond that. So it's kind of like I don't know what I can like it to. I'm not very good at analogies, but I was trying to like it to some kind of vehicle. But if you take away the engine is what makes the car function, doesn't it? But I'm not a mechanic, but I bet that if you take away the engine of a vehicle, there is a way in which you can get that vehicle working just by using some underlying components of that vehicle. Just a thought, I don't know, because I'm not a mechanic. But, electric cars, for example, what makes an electric vehicle run?
A battery.
Is energy, right? Energy makes a vehicle move. Energy makes everything move. Energy makes everything.
Okay, so the bottom line is you can use hypnotherapy to improve the quality of life of people who are living with dementia and people who are not living with dementia.
Absolutely.
Anyone.
Yeah, I use hypnosis with family members too, and they benefit from that greatly, because, of course, as people know, if you are supporting somebody who is living with those challenges 24 hours a day, 7 days a week, and that is tough. That is really tough. And so that individual also needs tools to cope, to manage, to be able to find inner peace and relaxation and time for self. So I often encourage both people. When I use hypnosis, very often the family member is in there as well, and they're learning how to do it, and they're learning self-hypnosis, because it's a fantastic tool to find, to add to coping strategies, to the toolkit. So, any more questions, Lynn?
No.
Thank you very much. Thank you for watching this really important video, because this topic, this subject has to be shared. Please share this video. Please share the video channel, the YouTube channel. Get people to subscribe to it so they can see all the videos each and every week. And the book, A Clinician's, long-winded titles, A Clinician's Guide to Non-Pharmacological Dementia Therapies. You can get that on Amazon. It's a book that was commissioned. It's not a self-published book, so I don't have them. I just have this one, and as you can see, it's well used and well worn. But you can get it from Jessica Kingsley Publishers. You can get it from Amazon. You can order it through Barnes & Noble, Waterstones, and other good bookstores. And just one more shout out to Dr. Simon Duff, who worked with me. He doesn't work in dementia. He's not a dementia specialist. He works in forensic psychology, But thank you for working with me on this, and big shout out to you, and I hope you're doing okay. And I can't wait to see you when I come over there in June. So thank you very much. Have a fantastic week. I was going to say happy Thanksgiving, but it's not yet, is it? It's a couple of weeks. Next week, we're going to have another really interesting topic of conversation. So please join us next week, and be safe, be careful. Go to our website, drdanielnightingale.com. Please contact us through this channel if you have questions. And again, anybody who's experienced hypnosis with me or with anybody else, any of the other people that have trained with me, please feel free to post your experience, and that will be fantastic. Thanks, guys. Be safe.